Welcome to Profits in Practice. I'm Sarah Webb, the host, and today I have Pam Hamby with me, and we are talking about setting up multiple sites. Thanks for joining us, Pam.
Oh, my pleasure.
Well, setting up multiple sites and clinics, I was like, okay, what can we talk about with Pam? We can extract from her some expertise. So you've been on a roll recently working with your clinic, setting up multiple sites, locations, credentialing. Kind of talk to us a little bit about that and what that entails.
A role for sure. Over the last year, we've opened up 8 locations, 7, soon to be 8.
Okay.
We have recruited 7 physicians. We now have 5 nurse practitioners. So we've been really, really busy. That's probably a record of any clinic situation I've been a part of.
Yeah.
But it's been fast and furious, good strategy behind it.
Okay.
So, we've been on a roll.
Well, tell me a little bit about the planning steps. Like when you were starting, you had your main location, I guess location number 1.
Mm-hmm.
How did you decide where to go next? Was it based on where your physicians were living or where you saw patients?
Really, I think when we step back and look at different location opportunities, we look at several things. We look at where the patients are coming from,
Mm-hmm.
where the referral sources are,
Okay.
where are the retail development going on, where are the schools. That really creates a good environment for a clinic location, especially in an allergy and immunology practice,
Okay.
where convenience is important for patients to be able to get their allergy immunotherapy,
They're in your
timely and convenient.
Well, and they're in your office probably a little bit more routinely than some of the others. And so
Yes.
that being close to a school or an easy access is definitely important. I feel like I'm getting older that I'm like always asking about the parking. I feel like that's like my parents would be like, what's the parking
Absolutely.
situation? But these are things that you have to consider.
You have to consider.
Yeah.
You have to consider moms picking up kids from school and dropping them by the clinic on their way home to, change to
Yep.
get ready for soccer games, baseball games, all those consideration and factors.
Yeah, absolutely. So when you're working on these locations, did you do a scatter, like we're opening multiple locations at one time, or did you focus on one at a time?
Oh, gosh. That was kind of crazy, Sarah.
Oh.
Because when we opened our clinic, when we started this practice about a year ago in October, it was a year, we had several physicians that were already practicing in those communities. So
Okay.
we knew that as we were bringing the physicians over, we had to have a place in a clinic location for them to practice on day 1. So in essence, we opened up 4 different clinics in a matter of 2 months.
Oh, wow.
And that was really because we were recruiting physicians who already had a presence in the community.
Okay.
And that was a huge feat. And I would not necessarily recommend that, but we had some seasoned physicians that understood what that looked like. And, it was a huge commitment though.
Well, so once you've decided on a location, walk through, or do you have to do re-credentialing? Like, what does that process look like as you're setting up these multiple sites?
Not necessarily re-credentialing, but adding locations to your contracts.
Okay.
So in our particular case, we are members of a physician hospital organization, a PHO.
Okay.
And fortunately, they do the heavy lifting for us when we add locations. Anytime you add a provider, you have to go through the credentialing process.
Right.
And sometimes it's helpful if have already been a part of a medical practice before. There's a process of changing, the new practice identifier within the payer contracts.
Mhm.
But then oftentimes it's, as you're adding new clinic locations, it's really about just adding that location to the payer mix.
Okay.
So it's a really easy process for us because we work with our PHO very well.
They got to know
very
you very
closely.
well last year,
Yes,
didn't
exactly. They sure did. And so we just report the new location to them, and then
Okay.
they add that to the contracts.
So with all these locations, how do you manage staffing and HR between all these places? And how do you have one staff person, a nurse that stays at one clinic, or does she float between the clinics?
It's a challenge.
Yeah.
It's definitely a challenge. And the number of clinics that you open in a certain amount of time definitely makes it even more challenging. I think for the most part, though, it's really important to have a team of good clinical and customer service front desk team members.
I want a welcoming face when I come to the doctor's office.
Absolutely. And what we've done in the past is when we bring new people on, it's almost like you have to bring them on a little earlier than when you need them.
Yeah.
Because they have to be trained and they have to understand the culture of the practice and how we operate, because one allergy and immunology practice may be different than another. So it's really important that they understand not only how to do the processes, but the culture. So it can be very challenging, but we have staff that travel to different locations.
Okay.
Usually we have pockets of clinics. So we have 4 clinics in this particular area, and then we have 3 clinics in another area, and then maybe 2 in another area. So we try to use the economies of scale to reduce the driving as much as possible.
Yeah.
But when we bring them on, they understand that they're going to be traveling some until we staff up at each location.
Sure. And as you're establishing these different clinics and the staffing, are you building out best practices, or did you feel like you had a playbook kind of based on your industry knowledge and prior experience of how you wanted the culture to be and how you wanted that, system to be at the front desk and ultimately the patient journey?
Definitely a goal, definitely a playbook. Having that consistency across the practice, though, when you have 8, 9, 10 locations, even more sometimes, it really is hard. I think it's communication has to drive all of it, really making sure that people, even from the interviewing process, onboarding process, their first 30, 60, 90 days with the practice, they have to really understand the culture, because I think that's what sets us apart, is really patient-centered approach across the board. So when you have people that have decided to work with you that understand that from the beginning, it really sets the stage of what the expectation is.
Yeah. And one of the things that I'm looking for when we're looking at staffing is like the ability to be flexible and learn. And, not like it always has to be this way. Like, yes, I want to have a very structured system. I'm an accountant.
Right.
But I do want some pushback of like, hey, have we thought about it like this? Or today I know you were going to work on this. I need you to be flexible and go work on something else because a team member needs help or a patient needs something specific. And so kind of interviewing for that has been really something I've been much more thoughtful about in the last few interviews and hiring that we've done.
Yeah, I agree. I think flexibility is key. And oftentimes people may think that they are very flexible, but when you're put in that position of really being able to multitask,
right,
pivot very quickly, sometimes people can, and sometimes it's more of a challenge. I think what we try to do, though, is have those core fundamental best practices, protocols in place, understanding that depending on the physician that may be there, the nurse practitioner that may be there, they may have a slightly different way that they operate through their day, but just those fundamental protocols are what's consistent across the practice.
Sure. We definitely don't want providers to be robotic, right? Like we want them to be able to serve the patient. But yeah, there's some core tenets of like, this is, I call it the Webb way.
Yes.
Because I don't have any other clever marketing term to come up with it, but it's imparting your culture in that piece.
Right.
So as you're rolling out these multiple sites and you had an opportunity, kind of a fresh start on technology, what was your process for selecting a technology and how do you ensure everybody's using it the same way across the multiple sites?
We chose the same electronic medical records that we had with the previous practice that a lot of our physicians came from.
Okay.
They were very familiar with that software. That was the easiest and best decision ever.
And you weren't unhappy with your software.
No.
I mean,
no,
everybody's unhappy with their software. There's
it never does what you want it to do, right?
But being knowledgeable and knowing how to use it is definitely half the battle.
Exactly. And, so it served the purpose previously, and it definitely served the purpose with us now. I think the other softwares that were really important for us from a medical practice, specifically an allergy and immunology practice, is an inventory management system.
Yes.
Roche was one of the softwares that we brought over. It's the shot room software. So, those are the 3 basic things that you have to have when you're opening up a new allergy and immunology practice. There are probably certain practices that may still do things manually. We're just not in a position to do that. So from a software perspective, that's what we did.
No, I would say your practice and your physicians are very technology forward. Like how can it help us be more efficient? How can we leverage this so that they have more time with patients? I mean, nobody wants to spend their time typing up notes or
exactly.
I don't know. Even as a patient, like that's not what I want my doctor doing. I want my
Right.
doctor focused on me and helping me solve my issue, my problem, or
Right.
whatever.
Right.
Now, we've talked about in other interviews payer contracting. You kind of had a fresh start. So some of the things we talk about in payer contracting is like, oh, you haven't looked at your contract in 10 years or you haven't renegotiated. What is it like to start that from like the beginning?
I think the whole payer contracting, I'm always very skeptical about how successful that's going to be.
Okay.
It was much more successful 20 years ago
Okay.
when the insurance companies really wanted to partner with physician practices.
They wanted you as a physician on their network.
Yes. It was something. Now it just feels like it's a one-sided relationship. And we do not really see a huge benefit of going back to the insurance companies every year.
Okay.
We do look at certain what we call CPT codes that are important to make sure that are staying
comparable, competitive, you're getting paid,
yes,
you're not losing money on them.
And in our practice, that would be the extract code, that
Mhm.
would be our shot revenue, that would be our skin test, CPT code. Those are the critical pieces of our
your
specialty.
practice, yes.
So there's always going to be those certain codes that you really want to focus on. And we do those. And I feel like that most of the time, we have our contracts, as I mentioned, through the PHO.
Mhm.
And we'll go back to them occasionally and just say, really, can we talk to the payer about increasing this or increasing that or whatever? I just think that time, unfortunately, for physician practices has not really continued to be something that we can count on.
Yeah. No, that makes sense. I think it's a competitive environment, but it's something that you always have to keep your eye on.
Yes.
Even if you don't decide to negotiate, it's, looking at it from the financials, extracting reports from your EMR. I mean, sometimes I get into practices and I'm like, oh, have you looked at the profitability by CPT code? And they're like, oh no, how do we do that? And I'm like, okay, well, let's
and your
pull
payer
this.
Mix,
Yeah. And your payer mix. Your payer mix is very, very critical.
Yeah.
How do you have discussions with physicians, or maybe talk to me a little bit about your reporting? Like, you've got these best practices, you've got these tenants in these multiple locations. Are you looking at performance by location? And like, what do you look at your office each week to say, okay, this one, I'm ready to hire that next person, or we need to do more marketing related to that site? What are some of the things you look at?
It's all that, it's all that. A great measure is the shot room. The number of patients coming in for shots.
Okay.
The extract lab, and how much extract we're making at any of the particular locations. When we are looking at the shot room volume of patients that are coming in, that guides us to whether or not we need to increase days at the shot room, because
days, hours,
whatever might need to be adjusted to be more convenient for the patient to come in and get their allergy shot. So we're looking at a lot of those things. We're looking at schedules. Every day I look at schedules.
Okay. Walk me through that process.
It's really funny because
you open it up.
I open up my EMR when I'm having my coffee at the first of the morning.
Okay.
So that's the way I wake up in the morning. And so I'm looking at the schedules, and I want to see where we're booking the most. I also look at where the referrals are coming in.
Okay.
We have, for example, in our practice, we're based in Tennessee. We have Middle Tennessee practices. We have East Tennessee practices. So we have referrals that are separated that come into our EMR that highlight and basically give us a list of how many referrals we have in each pod of offices. So I'm looking at that. I'm looking at schedules. I'm looking even at the infusion, schedules for the day. So it's really a collective approach for all those things, but really that's how you have to do it. There's really no guide out there that says once you get this number of shot room patients, it's time to hire another shot room nurse. Yeah. When you have, we look at how quickly our physicians are booking their new patients. That's a big
new patients are how right now. What's kind of the average time frame? If I was to call today, when could I get a new patient appointment?
Depends on where you are in our location. So right now as a new practice, it's pretty quick availability, but within a couple of weeks.
Yeah, to me, that's
Which
a
is great.
reasonable. Yes,
Yes.
absolutely.
Yeah.
Well, and we're kind of talking earlier about staffing. That schedule piece kind of gives you the leading indicator of like, are we ready for that next staff person, or do we need to adjust some hours? And we had previously chatted like, you always really need to hire a little bit ahead of where you want to be as you're onboarding and training people.
Right. And it depends too on the physician. Some of our physicians are very, they take advantage of some of the opportunities within the EHR to have ambient listening, help them with their dictation and the new patient visit. It reduces the need to have a scribe or a nurse in there. So we're kind of learning how to incorporate some of the technology that will help us make sure that we have the staff that we need, but not more than we need.
Yeah, no. And I think that's always like something to be learning and to be, I don't know, built upon every time. Like every time we hire someone or we work with a clinic, it's like, okay, this was the onboarding process and we thought this was the best thing that we have. And then we'll go through it and we're like, we forgot something, or how could we make this better? And so it's the repetition over and over and over again that you're just refining it every single time.
It takes a while.
It does take a while.
It does take a while.
Well, looking back at all these sites that you brought to life, is there anything that you would do differently, or would you have like you're over a year out? Would you have like done the locations differently or come up with a different methodology, or you feel like now that you're here, you're like, yeah, that we probably rolled that out okay?
I think it's that. I think we probably rolled it out okay. It's, anytime you do that, you're standing up different locations, you're bringing on, physicians and nurse practitioners. There's a huge economic impact.
We got to get going pretty quickly.
We've got to get going pretty quickly.
Yeah.
And so what we have done over the last year is before we open the office, we have our marketing team. We have a marketing team that absolutely just takes over that particular community to let the physicians know, the referring physicians in the community know that we're coming.
Okay.
So that's helpful to prepare the community that they're going to have another allergy and immunology option. So I don't really know that we would do it any other way.
Yeah.
It's been fast and furious.
And now that next location, that's going to be your next best one, right? Like you're going to be like, oh, this was so much easier than the others and things like that.
Yes.
So, well, thank you so much for joining us. I thought this was excellent advice of opening up multiple clinics. I think it's something that physicians and clinic practices are curious about. It sometimes feels a little daunting. And so, probably wouldn't recommend to someone opening their first, second site to do 4 at one time, if I'm honest. But opening up that second site and considering the staffing and the credentialing and adding to the payer contracts, I think those are all things to consider when you're opening up a new clinic.
Right.
Yeah.
Right.
Thank you so much for joining me.
Thank you.
Thanks for tuning in to Profits in Practice with Sarah Webb. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with a fellow physician. Your financial wellness is just as important as your patient's health, and we're here to help you thrive. Connect with us via our website at webcfo.com and connect with our guests at ciiclinics.org to find out more about the consortium.